Plantar fasciitis is a condition where there's inflammation of the plantar fascia, which starts from here and it goes down, and often the pain will occur right in this area here. And often the reason why that happens is because there's persistent splaying of this plantar fascia, pulling, which is causing irritation at the spot. Common times to get it is, let's say if you started a workout, if you're exercising a lot, there's a lot of demand on the plantar fascia, will cause symptoms. And also if you are starting a job that requires multiple hours of standing, that's also something that can cause it. And usually the symptoms are, it's the worst in the morning when you first get up and you take a couple steps. So some of the common things that once you do come into the clinic, what we do is, first of all, what we have to do is we have to figure out which activities caused the inflammation, get rid of those activities for a little bit, let the inflammation calm down, and at the same time start doing stretching. So stretching of the calf and stretching of the fascia. That's a really good exercise that you can do. In addition to that, you can also use the ball, working on the ball. So Ella, bring the leg up. There you go. So releasing the fascia with the ball. Another trick that you can use a water bottle, a cold water bottle that you put in a freezer, and you take that out and you roll the plantar fascia. So we also look at, when you do come into the clinic, we look at the footwear, what type of footwear you have, whether that footwear is appropriate for the activities that you're doing, or whether we can modify the footwear a little bit in order to improve that, reduce the inflammation. Another thing that we look at is potentially looking at getting some orthotics as well, custom orthotics, where we come in, do the whole assessment, and we basically utilize a digital 3D scanner system, which will basically map out the foot, and you get a custom orthotic, which can help reduce the amount of strain that's happening on plantar fascia. And I often find it and recommend it for patients that are standing for prolonged periods, that are standing multiple hours, and it does reduce the inflammation of the plantar fascia. In addition to that, you can also do strengthening exercises, where you got a towel and you are scrunching. Good. So you're using the plantar fascia muscles to strengthen them, and you're also creating this arch. Because once again, plantar fasciitis occurs is when this arch falls and you're lengthening the plantar fascia repetitively. So what we want to do is we want to try and strengthen the arch muscle so that the arch, when you do stand, is not falling. Good, so maybe stop it there. If we do find that the patient would benefit from custom orthotics, based on our assessment, we would do a digital 3D scan based on what their foot is, and we would send that off, and they would send us a custom orthotic. So the scan is like so. There we go. And then based on this scan, they'll be able to get orthotics that we feel would be appropriate for the patient.